What is a cough? A cough is your body's way of responding when something irritates your throat or airways. An irritant stimulates nerves that send a message to your brain. The brain then tells muscles in your chest and abdomen to push air out of your lungs to force out the irritant. An occasional cough is normal and healthy. A cough that persists for several weeks or one that brings up discolored or bloody mucus may indicate a condition that needs medical attention. At times, coughing can be very forceful. Prolonged, vigorous coughing can irritate the lungs and cause even more coughing. It is also exhausting and can cause sleepiness, dizziness or fainting, headaches, urinary incontinence, vomiting, and even broken ribs.
A sore throat is pain, scratchiness, or irritation of the throat that often worsens when you swallow. The most common cause of a sore throat is a viral infection, such as a cold or the flu. A sore throat caused by a virus resolves on its own. Treatment for sore throat. A sore throat caused by a viral infection usually lasts 5 to 7 days and doesn't usually require medical treatment. Antibiotics don't help treat a viral infection. To ease pain and fever, many people turn to acetaminophen or other mild pain relievers. Consider giving your child over-the-counter pain medications designed for infants or children, such as acetaminophen or ibuprofen to ease symptoms. Never give aspirin to children or teenagers because it has been linked to Reye syndrome, a rare but potentially life-threatening condition that causes swelling in the liver and brain.
Urinary tract infection, or also known as UTI. A UTI can be found in children from infancy through the teen years and into adulthood. Symptoms of UTI include pain or burning during urination, the need to urinate frequently or urgently, bedwetting or accident by a child who knows to use the toilet, abdominal pain or side or back pain. Treatment. In many cases, treatment involves your child taking a course of antibiotic tablets at home. As precaution, babies under 3 months old and children with more severe symptoms are usually admitted to the hospital for a few days to receive antibiotics directly into a vein, or also known as intravenous antibiotics.
The common cold is a viral infection of your nose and throat. It's usually harmless, although it might not feel that way. Many types of viruses can cause a common cold. Healthy adults can expect to have 2 or 3 colds each year. Infants and young children may have even more frequent colds. Most people recover from a common cold in a week or 10 days. Symptoms might last longer in people who smoke. Generally, you don't need medical attention for a common cold. However, if symptoms don't improve or if they get worse, go see your doctor. So what are the causes of common colds? Although many types of viruses can cause a common cold, rhinoviruses are the most common cause. A cold virus enters your body through your mouth, eyes, or nose. The virus can spread through droplets in the air when someone who's sick coughs, sneezes, or talks. It also spreads by hand-to-hand contact with someone who has a cold or by sharing contaminated objects such as eating utensils, towels, toys, or telephones. If you touch your eyes, nose, or mouth after such contact, you're likely to catch a cold. What are the treatments that can help children to prevent common colds? Number 1. Wash your hands. Wash your hands thoroughly and often with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Teach your children the importance of hand washing. Avoid touching your eyes, nose, or mouth without unwashed hands. Number 2. Disinfect your stuff. Clean and disinfect high-touch surfaces such as doorknobs, light switches, electronics, and kitchen and bathroom countertops daily. This is especially important when someone in your family has a cold. Wash children's toys periodically. Number 3. Cover your cough. Sneeze and cough into tissues. Throw away used tissues right away. Then wash your hands thoroughly. If you don't have a tissue, sneeze or cough into the bend of your elbow and then wash your hands. Number 4. Don't share. Don't share drinking glasses or eating utensils with other family members. Use your own glass or disposable cups when you or someone else is sick. Label the cup or glass with the name of the person using it. Number 5. Stay away from people with colds. Avoid close contact with anyone who has a cold. Stay out of crowds when possible. Avoid touching your eyes, nose, and mouth. Number 6. Review your child care center's policies. Look for a child care setting with good hygiene practices and clear policies about keep sick children at home. And lastly, take care of yourself. Eating well and getting exercise and get enough sleep is good for your overall health.
What is ear pain? Ear pain otalgia commonly occurs in children but is also happen in adults. Pain that begins inside the ear is known as primary otalgia, whereas pain that originates outside the ear is known as secondary otalgia. Right up arrow, ear pain can arise gradually or all of a sudden. The pain can feel dull, sharp, or burning and can be temporary or ongoing. Usually, the pain arises in only one ear, but sometimes it can appear in both ears. Causes and risk factors of ear pain. Ear pain is often caused by a blockage in the eustachian tube, that passageway that extends from the middle ear to the back of the nasal cavity and the throat. Ear infections are common caused by ear pain, especially in children. Middle ear infection, called otitis media, occur when fluids build up in the tube inside the middle ear. Right up arrow, this fluid can then become infected by bacteria or virus. Treatment and medication option for ear pain. The treatment for ear pain often depends on what's causing the problem. Common treatments include medication, surgery, and home remedies.
Skin infections are caused by a wide variety of germs such as bacteria, viruses, and fungus. These can enter the body through a break in your skin such as cut or scratch. Symptoms can vary from mild to serious. Treatment depends on the type of infection and how serious it is. Some can be treated by good hygiene measures such as cleaning the area with warm water and covering it with a plaster or bandage, or over-the-counter medicines such as antifungal creams, whereas other infections may need medical attention such as antibiotics for cellulitis.